Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen, CEO and co-founder of 3W Medical for Women and the host of today's podcast. Hi there, Wellness Wednesday listeners. I have two of our beautiful clinicians in the podcast room today, and it's a Monday, so I'm still waking up from my beautiful weekend. So I apologize. I'm going to let both of them talk a lot because I'm having a hard time putting words together. I think that you've heard me talk many times about our FEMM program. I can't rave about it enough. It's just a wonderful service that we're continuously building on and moving into more growth for this beautiful service that we're providing to the community. How we're going to take it to the next level is with Shannon and Adeola. These are our two beautiful clinicians. Adeola's our naturopath, Shannon's our nurse practitioner. And the two of them has embarked on this okay, we're going to drink from a fire hose. That's what it feels like to me. We were like, go to this conference in June and then learn all these things and then come back and implement it. And they're like, okay. And that just tells you they're game to do this. But next quarter, this next, beginning of 2026, we really want to expand our FEMM program. And these two clinicians are helping us do so. And Adeola, I'm going to tap you really quick. Our FEMM program has always been the teaching part of things. I think that's one of the things I really want to hone in on today is how is it different from what we've been doing before? Because we've had our FEMM program and it was mainly Lauren. She's been holding that torch as our certified FEMM teacher, but there's more to FEMM than just the charting part. It's very important, but now we're building on that. So can you tell us a little bit more about what that means in your understanding of it?
Sure. So yes, the teaching portion is foundational and fundamental, I think, for any woman who has noticed variability in her cycles or is hoping to become pregnant in the future or is dealing with symptoms related to the cycles or with hormones and wants to know what exactly is going on in her body. It's not something that we learn as young women growing up. Is
very
what
unfortunate.
Is the menstrual cycle, what to expect in the beginning part of the cycle, the second part of the cycle, which hormones are related to it, and what do those hormones do in your body other than create your reproductive cycle, because estrogen and progesterone have receptors throughout the body, in the brain, in the digestive tract, are important for your immune system. So learning a little bit more about what to expect in your cycle is super important. But then when you find out by charting that maybe you're not ovulating or maybe what should be a higher rise in one hormone isn't happening, or just something is off and you're starting to notice it symptomatically, or maybe you don't notice it symptomatically. Like there are lots of people who have a period every month, but then if they start to chart, realize actually they're not ovulating every month and they're not seeing the signs of ovulation. So what do you do from there? And that's what we are starting to build out as this FEMM Medical Management program now that if you have noticed that something is off with these cycles, what do you do about it? A lot of times people will go to their primary care physician or to a gynecologist or maybe even to an endocrinologist, but a lot of people don't have all that access.
Yes.
And a lot of those practitioners haven't had some of the training that we've had now through FEMM, which has been remarkable with regards to the research that's gone into understanding what happens in the cycle, and not just the reproductive parts, but also what happens in the brain. How does it affect the mood? How does your metabolism impact your hormones? And there are lots of diagnoses that are, I don't want to say poorly managed, but not managed comprehensively with the comprehensive understanding that we have now started to to get through the FEMM program, and we'd like to share with the women who are coming in looking for more answers. So that's the difference is before with FEMM, you're learning what's going on in your cycle. And now that if you have learned that there is a consistent dysfunction, now we are opening the doors to help you dig into what that means, to look comprehensively at lab values. So do a really complete workup, look at metabolism, look at hormones, look at androgens, if that's something we're considering with a PCOS picture, at some of the markers that might determine fertility, and then help you decide how to move forward from there.
Yeah. That's going to be such a huge gift to our community. And Shannon, how do you see that complementing the patients that we see in our clinic? I want to say this has been a conversations that we've been having for a long time, and now we have the both of you to enter into this next phase, and it's going to, I want to say, it's going to change women's health in our city, because we're going to be the first FEMM clinic, essentially, right? And so, have you seen that pattern as you've been seeing patients with us? How do you think this is going to change for our patient population?
Yeah. So previously we would have gyne consults, and time and time again, I was like, oh my gosh, this is a FEMM patient. This is a FEMM patient. Because it would be the patient either not having a period at all, having irregular cycles that are, some like 60 days apart. Maybe they're having horribly painful, heavy periods that they have just normalized their whole life, where I'm sitting there, this is not normal at all. Like, we need to dig deeper into this. And before we had implemented the FEMM program, it was our job to, counsel those patients, take in their information, and kind of guide them where they needed to go and say, this is what it's looking like, whether it's PCOS or endometriosis or thyroid issues. And we would send them to the right people, whether that is endocrinology, OBGYN, or PCP. But now we get to actually take care of those patients and do the labs and order the imaging for them so that we can keep them with us, because ultimately then we get to build this relationship with them and help see them through and on the other side of it. And I can't even tell you how many patients I've seen that have said, I've just always had these horribly heavy, painful periods, or, I lost my period for the last 3 months. I don't really know why. And when you recommend them to go elsewhere, it doesn't always happen, because it is hard. And I understand as a patient, it's like you want to go to another place, and now we get to actually provide all those services for them. So it's a huge gift for me, because I just think we're going to be able to help so many people. So I'm just so thankful that we're able to do this training and are able to bring it to our patients.
Yeah, I mean, you both know how important this topic is to me, just on a personal basis, with my walk with endometriosis and infertility and all of that stuff, and I just never, from a personal standpoint, I just never want another patient to have to go through what I went through with being misdiagnosed or ignored, or just, I hear it all the time between the two of you. Unexplained infertility. Isn't that the most frustrating diagnosis?
Yes.
It's not a diagnosis.
Right.
It's not a diagnosis. There's underlying issues, and you're just lazy, and you just don't want to actually pull labs or dig deeper or ask better questions, or, and all of that stuff. And I hear it every single time when I go out and do like a talk at some place about what we do. There are people that come up to me and say, like, can I come to you guys for painful periods? Can I come to you guys for just a deeper dive? Because I'm not getting the care that I need. And I think it's a travesty that it takes 10 to 14 years on average to diagnose an endometriosis patient.
Yeah.
What?
Horrible.
Yeah.
Why?
Yeah. That's a lot of ignoring someone. That's years and years of ignoring someone's signs and symptoms.
Right.
And ideally, an endometriosis diagnosis is a surgical one where, there's an exploratory surgery to see if there are endometriomas or signs of endometrial tissue where it's not supposed to be sure.
Right.
But before then, there would have been lots of symptoms that would make a clinician think maybe we should rule this out sooner than later. Let's just make sure it's not endometriosis.
Yes.
And then if it's not, wonderful, we can move on and think about other ways that your body is maybe really sensitive to hormones and causing pain. And just to ask more questions, really. And what's beautiful about being able to provide the FEMM Medical Management is that we can provide continuity of care.
Yes.
So like Shannon was saying, before we would have to educate and counsel as much as possible and then hand someone off. But I think because we spend more time with our patients, we get to know them at least a little bit, it can be really hard to just send them off. You are now, you've listened to them, you formed a bit of a therapeutic relationship and you like for it to continue. So I'm really excited to be able to continue that relationship and just keep asking questions until we find answers that make sense for them. And then also, I think because of the way we practice here, we want to look at this woman as a whole person.
Yes.
You're not just your lab values, right? You're an entire person in context. So because we're able to spend more time with our patients, we can understand you in the context that you exist in a little bit more easily. And then provide care and education that matches you where you are and will also take you where it is you want to go.
Shannon, what would you say to folks out there who think that FEMM is just falls under the category of the rhythm method or, I mean, because a lot of people think that FEMM doesn't work. Right. There are these myths out there. They put it in this category of just like, oh, this is a religious thing, or it's really for women who want to have 8 kids and space that out, right? How does this apply to me as a young woman who's not married, who's single, who really just wants to learn more about her body, trying to avoid pregnancy? But how would you explain that to someone that has these like stereotypes about what we're trying to talk about?
Yeah. So the rhythm method is very outdated.
Yes.
And a lot of the statistics given for fertility awareness-based methods were based on that rather than the actual accuracy of these programs. And FEMM is highly, highly effective. I want to say it's like 98% or something when done in the right way.
Yes.
And in your teaching sessions, you're taught exactly when you can have intercourse if not having a baby is the goal. And then the beautiful thing is on the flip side, when you are ready, then you have the tools of maximizing the possibility of getting pregnant because you know that fertility cycle. So I just think it's such a beautiful thing to be able to learn about your body because like Adeola said, we're not taught this in school. I was not even taught this in nurse practitioner school. I literally learned this last year for the first time. And I was like, what on earth? Like, how was I never taught this? I am now 40. I was almost 40 then. I'm like, I'm an almost 40-year-old woman who went through sex education in school, who went through nursing school and nurse practitioner school, and had never even heard of being able to know exactly when I ovulate. And kind of ties to my own personal story and why I'm so passionate about FEMM, because I also went through my own infertility journey years ago. All 5 of my kids are from IVF because I was told then this was the only way that you're going to get pregnant. I did have a diagnosis. It was hypogonadotrophic hypogonadism, which is always really fun to say, or hypothalamic amenorrhea. And it really was just kind of like, IVF is the way that you have to go. There was no explanation of like, there's a way we can resolve this, which I also think when going back to the endometriosis comment is so often in medical school, sadly, clinicians are taught that birth control is the solution. And yes, it might help with symptoms, but it is never, ever going to treat the root cause. And so that's what I think is so wonderful about FEMM is that we don't want to slap a Band-Aid on your problems. We don't want to just make your symptoms go away. We want to actually get to the root cause of those symptoms, treat the root, so that then the symptoms resolve. Anyway, so long story short, when I started learning about this myself, I was like, I want to figure out the root cause of my own issues. So worked with a clinician that was trained in FEMM and fertility awareness-based methods, and working with her was able to get my period back after 20 years, which you guys both know, but like is literally felt like a miracle. But I think the coolest thing for me is that I'd also gone through the FEMM teacher training because I wanted to know what my teachers were going to be teaching my patients. So when I hadn't yet had my first period, all of a sudden I was like, I have estrogenic mucus, and then started testing for if I was ovulating, and then I did ovulate, but like without that knowledge and that background of the FEMM education, I would have just been kind of like shot in the dark, and all of a sudden my period would come like 2 weeks later and be like, surprise. But I love the certainty of it. And it's not always that way. But for most women, like their luteal phase is going to be within a range of like 1 to 2 days, basically. And then if it's not, you know, something's off. So once you ovulate and you figure out your peak day, then you can almost certainly say, I'm going to start my period on this day or this day. And so there's no surprises. You can be prepared for it. But that's where it just really ties to my own personal story, because I think that had I had the opportunity to fix my root years ago, I would have had a different outcome. And I always say I would never change my story because I wouldn't have the 5 kids that I did. But like you, I just don't want anyone to ever go through that again, because going through the IVF process was really one of the hardest things I've ever been through, like from emotional standpoint, physical, spiritual, emotional. I mean, all the things. It was really, really challenging.
And no one talks about it.
Right.
No one talks about it. Everybody's just like,
just go do this and it'll solve all your problems. And there's a lot more that goes into it. But now I know there's such a better way. And that's through a program like FEMM, where we actually care about what is causing your symptoms and why these symptoms are occurring, and treating that so that it's not a 14-year diagnosis, or it's not, 20 years later, like for me, that all of a sudden I'm like, oh my gosh, I could have done this a really long time ago, but had no idea, because nobody ever said like, you can actually fix this. It was just, here's a solution. And
yeah. Wonderful. Adeola, how would you answer the question of like, who is the ideal FEMM patient? Because we've invested in our FEMM teachers to also take the teen FEMM track. So I think a lot of people are under the misconception that this is just for 20-something-year-olds that are like getting ready to get married and they want to maximize their fertility now, because now they're in the season of life, like welcoming children. And I think that's not true. I mean, like, it is and it isn't. It's more. It's right? Because we feel very strongly that the minute you start menstruating, you should take a teen FEMM course with our teachers and get ahead of like knowing about your body. There are women that are going through perimenopause, menopause, like this is a program for a wider audience, right?
Absolutely.
Right?
Absolutely. I absolutely think that even before menarche or early menarche, girls should be treated at an age-appropriate level, exactly what's going on in their bodies.
Yes.
And I think it is a crime that girls are not well-equipped to understand their bodies and to make choices.
Yes.
Some will choose not to have sex, let's say, right? So there's some people who have a religious background or a value system that want to abstain until they're married.
Yes.
Wonderful.
Yes.
There are some women who do not.
Yes.
Everyone needs to be well educated on how their body works so they can make informed choices.
Yes.
I like to think and say that there is no safe sex. It's not possible. Sex is not a safe thing to do. It's a thing that, yes, is pleasurable, but it is intertwined with life.
Yeah.
It's kind of a life or death situation and choice to have sex.
Yeah.
And I think that needs to be imparted on people.
Yeah.
And on young kids first. And I was just telling a mom recently who were talking about how to educate young girls, 12-year-olds, about their bodies. And she was saying, well, maybe it's not appropriate quite yet to talk about STIs. And I think it absolutely is appropriate to talk about STIs with 12-year-olds.
If parents don't talk about it, the world will tell your children.
Yes.
I mean, that's the reality of the situation at this point.
And they will tell them the wrong thing.
Yes.
Right? And there are lots of young girls who don't learn about STIs and don't learn about their bodies and then end up being vulnerable.
Yes.
And I think what I am passionate about is to educate young girls and women so they are less vulnerable, so they are not vulnerable, so they are informed. And the thing is, it's a matter of brain development. Girls' brains develop faster.
Yes.
And our frontal lobe is not fully formed until like we're 25. But girls' brains will develop faster and have a different, let's say, cognitive capacity. And I think a lot of times girls can be taught, coerced, groomed by men or young boys or older boys who just don't fully understand the information and are not necessarily speak from a place that has your best interests in mind. So if you are a young girl and you start a period, I think it's really important for you to know when you are fertile. It's really important for you to know and for you to be able to make choices. And I think you should be really, and that is why FEMM is great for young girls. So you know there are certain days in the month where you can actually become pregnant. And now you can make choices based on that. And same, I feel like I always bring STIs in because people are not well educated on STIs, and people think, and I've had lots of patients who think if they're on birth control pill, then that's all they need to do to be safe. And so that is absolutely not safe. One, I've had lots of patients who've gotten pregnant with an IUD and with birth control, oral contraceptives, really any type of birth control. I've seen people get pregnant while they were using it. So that is always a possibility.
And I always say, there's that movie, I don't know if you guys have seen that movie where they were making fun of like condoms, and so they put the condom all over their whole body, and that's how they had. I was like, that's the only way to avoid an STI if you're going to use a condom. You put it all over your body.
That's so funny.
Yeah, I mean, just think about. I was talking to our medical director Jen the other day about STIs and how, like, for example, herpes.
Yeah.
Herpes likes to hang out in places where condoms don't cover.
Yes.
And the problem is people don't talk about herpes.
Yeah.
And it's a lifelong diagnosis. So if you think you're having safe sex, you have a birth control pill and you're using a condom, you can still contract herpes, and that is for your whole life. Yes, you can manage it with antivirals, but it's there in a nerve root, infected forever. So I think it's really important for women of all ages to have an age-appropriate awareness and understanding so we can make informed choices. So it's not just for women who are deciding to welcome children or welcome families or going into perimenopause. I've had lots of people who are perimenopausal and menopausal who, after we talk about hormones, and hormone balance and what to expect based on their stage of life, say that they had never heard this. We're talking about women in their 50s.
Oh, yeah.
So there's no age limit on being appropriately informed about what's going on in your body.
Right. I mean, I always, whenever a supporter, like a donor, asks me, like, what's been your youngest patient? What's been your oldest patient? I was like, 13 and 85. That's the range, right, of patients that have come through our doors. And I remember the 85-year-old because she came in for STI testing. Right? And she had no idea how she got it and had wanted to get tested for it. And, you know, and I'm like, okay, we are in a whole different ball game talking about this right now. And so there's always an opportunity to learn. There's always an opportunity to build on what we've learned. I mean, we've had 30-year-olds come through our door not knowing how to wipe the right direction, so they keep getting UTIs, right? And those are kind of things that I'm like, where was your auntie? Where was your mom? Where was any of these people who in your life that could have poured into you? Right. And so I feel like this is for some, it might be an uncomfortable, taboo conversation, but this is how we've gotten there, is like we just reserve these things for these types of conversations for behind closed doors and think that women need to figure it out or live with painful periods because that's a normal thing. It's not. And we should be much more aware of these kinds of things. And you, Adeola, you're one of those people that I hear in my head about when I go and talk to young women, especially young girls. Of course, we always want to speak from a place of, this is the season in your life. We're going to make it as appropriate as possible to not replace what your parents, we want to align with parent values. But you constantly remind me of, we want to keep our children as innocent as possible, but not naive. Yeah. We want them to know when they're being lied to, when they're being manipulated, when they're being coerced, when they're giving misinformation about their bodies. And I think that's so important for young women these days because it's a confusing world.
It's a confusing world. And I think we also need to educate young girls, young boys as well. Absolutely, young boys, young people.
Yes.
We need to educate young people in how to think.
Yes.
There is so much exposure from peers on social media.
Yes.
And my problem with social media is that it tells you what to think.
Yes.
And then once you watch this video, then you get lots more like it. So now you're in an echo chamber with the same ideas. I mean, it may not even be true.
Yes.
So we need to teach young people to really question what they are consuming.
Yes.
And to learn how to think. And it's like a question of conscience. Like if you have a good conscience, then you can make the right decisions, but you have to inform a conscience. So we need to build a very strong foundation for how to think, how to poke holes in the theory that you've been exposed to. Like, does that even make sense that you can get pregnant every day of your cycle? No, that just isn't how the body works.
Right.
So we need to give kids fundamental facts. And a lot of people now have apps, right? So fertility period trackers and fertility awareness type apps. And those I think have been really helpful. And I have lots of patients come in showing me when their last period was and how they've been tracking it. Super helpful. But what I also still find, and Katie Vidmar mentioned this, is that we want women smarter than their apps.
Yes.
Because
do not rely on that.
No, because it's just like any program. Like, do you remember ever learning like the very basics of like computer programming? And it was something called GIGO, garbage in, garbage out.
Oh no, I don't know that specific one.
Oh yeah. Yeah. I remember learning GIGO, garbage in, garbage out. So if you put garbage into your program, you'll get garbage out. So you're building a program that adds numbers. If you put silly functions in, you get silly answers. But it's the same with these apps. They're just algorithms. So if you put information in there that isn't necessarily the right information, or you don't understand exactly what it's trying to give back to you as far as feedback, then it's still going to be confusing.
Yeah,
you're still not going to know how you got pregnant on the cycle when everything looked like it's supposed to be. So we do need to be smarter than these apps. They are supposed to serve us. They'll predict things, but it doesn't know what's going on with you. It doesn't know what your hormones are doing. If you don't track your temperature or track your cervical mucus, then it doesn't know when you ovulated. It's just saying, this was your last period, you're going to ovulate somewhere around here. But if something happened, you had a stressful time around ovulation, if something shifted and you don't ovulate around that time, it's still going to guess based on past cycles or just what it thinks it should do. But it might be different if you are not putting the right information in there.
Yeah, I always use these apps to like help me figure out when I'm going to go on my vacation. Because you don't want to go on a beach with, with your period. It's just going to put a damper on things, right? And so that's like another thing that I think about when I think of FEMM is like, you get to really help yourself plan your schedule in your life, right? If you're like me, you don't want to go to Hawaii and sit on the beach the whole time because you're afraid sharks are going to smell your blood in the ocean. So you're just like,
oh my gosh,
we can't go this week because I'm going to be bleeding, So let's, even just you want to do that, our FEMM program could help you navigate those types of situations. So Shannon, what would you like to say to our future of potential FEMM patients? What's your go-to thing to get them to take a class? Because that's what we want, right? We want folks to give it a shot because it's a win-win situation for everybody.
Right.
It's such a great investment in your healthcare.
It really is. And it's not just about getting pregnant or avoiding pregnancy. It's literally about your health and your overall health. And I think that's the thing I've learned the most. They call ovulation the fifth vital sign. And it really is an indicator of health. Like if you are not ovulating, there's something else going on, whether it's, an autoimmune thing or your thyroid or insulin resistance. And so to be able to actually know, yes, I'm ovulating, and not because an app is telling you that you are, because those apps usually are going to say that on day 14, you're going to ovulate. I can tell you, I do not ovulate on day 14. And most women actually don't. And like Adeola was saying, it's that follicular phase that can be shorter or longer based on stress. You're getting married, you're going on vacation, all these things. So to actually know for yourself, yes, I'm ovulating, and then be able to do something with that information. But so for that, it's just, you're going to be so much healthier and also empowered. And I think, like Adeola was saying, to be informed, that's what we want, is we want to give women this knowledge so that they're informed, but so also that they're empowered, and then they know, okay, my cycle is not how it should be, because I know what a normal cycle should be. And then they're going and seeking, saying, Mom, I need to see a doctor because I'm not having a period now, which for me, 20 years ago, they told me that was normal. And they are like, oh, you're just an athlete. You're playing college soccer. Then you're doing marathons. It's still normal. It's still normal. And it's never normal not to have your period. And so it's things like that where I think when you have that information and that knowledge, then you feel so much more confident to go and say. And then if a medical professional is like, oh, it is normal, you're like, okay, you are not the right medical professional for me, and I need to see someone else. And you don't stop until you get the help that you need, and you actually get the labs done. And that's another thing that a lot of times, if healthcare professionals are under the false assumption that someone's ovulating on day 14, they're going to get these, day 21 labs if you're doing it in the second half of the cycle, where you want it to be lined up with your actual day of ovulation plus 7, not what is like quote unquote the average, because that could not apply to you, and then your labs are going to be not giving a full picture. So I really think this is for everyone. I don't know what like population I'm most excited for. I like the young girl, because I have 2 young girls. They will know they already know more than I probably ever did, because I just like can't stop talking about it. But all the way through to the people in perimenopause and menopause right now, there's so much chatter on social media so much confusion that women have. But that's another area that FEMM we are trained in and can help those women too. So it's not just the woman who's having cycle issues, the woman who wants to get pregnant, it's a woman going through perimenopause and menopause, and understanding, what we can do to help support their body through that phase, so that it's not this horrible, dreadful thing, because it really shouldn't be. So I just think it really is for everyone.
I'll say one more thing.
Yes.
I think a lot of times women are intimidated about their body and about their symptoms. And I just want to say that your body is not an unsolvable mystery.
No.
Okay? And that you are smart enough to learn exactly what's going on in your body. No one knows more about your body than you do.
Yes.
And you really deserve a clinician who's going to listen to you and link arms with you to solve whatever mysteries and signals your body is sending you, because there are answers to those questions. So please feel confident in what you know about your body, and know that there are people out here who want to help you figure things out and live your best possible life.
Yes. Yes. You don't need a biology degree. You don't need to be... You don't need a medical degree to know any of this. You just need to honor your body and what it's trying to tell you. Just listen.
Yes.
Right?
Yes.
And just be like, what are you trying to tell me, girl?
Yeah. What's going on in there?
What's going on? What's coming out? What's going in? Right? And just trying to listen to all of that. So I'm so grateful for the both of you to bring your years of healthcare excellence and expertise, and then dive into this next phase for our organization, because we're going to be able to say, you're not crazy. Your periods should not be debilitating. If you want to space out your pregnancy, you want more kids, you don't want more kids, like all of those conversations can be had in the context of evidence-based with a medical professional that can navigate that with you. It doesn't have to be scary. Just this weekend, this beautiful young mom came up to me with 2 little kids screaming. They're adorable. So I was like, you can scream as much as you want. But she was like, I need to talk to someone about my period. I'm, I just had my baby. What do I do? What do I do? Yeah. And I was like, call us tomorrow and talk to either Adeola. You come and make an appointment with Adeola or Shannon, and they're going to help you with this. And you can just see like, okay, I can have this conversation, and I'm not a bad person. It doesn't mean that I don't want more children. It just means not right now.
Right.
Just for my mental health. And that's okay to have. Yeah. And so I'm just so grateful for the both of you who we were like, can you take these classes and come back and do this? And you said, yes, let's do this. And like I said, I'm just excited for the next person to sit across from you and be like, I'm finally seen, heard, loved, and informed about what to do next with my body. So I can't wait to blow up FEMM in Washington State. That's what we need. So thank you both so much for what you do.
Thanks for the opportunity.
All right, folks, if you're curious about more curious about our FEMM program, would love to welcome you, make an appointment. This is your time to take control of what your body is trying to tell you, and really listen and understand and honor what your body is trying to tell you. And we're so excited to walk alongside you. Please see our clinicians. They're wonderful and excited and very, very passionate about this program. So make an appointment. Do it. Do it today. All right. Thank you, ladies.
Yeah,
Thank you. Thank you. For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.